My name is Dr. Brad Fackrell from Synergy Spine and Nerve Center. Today we're going to be demonstrating how to use the mobility disc to improve the mobility of your lower back. Sabrina is demonstrating how to use the mobility disc. What's important is it's just going to increase the mobility in your lumbar spine. What she's doing is she's doing full circles at least 20 times. Now you can do more than that if you want. After she's done this 20 times one direction, then she'll switch directions and go the other direction. There are a couple of critical things when you're doing the mobility disc. If you just do very small circles, you're not getting as much benefit as you do full range of motion. You really want to get the lower back, the joints in the lower back to really open up. And also, if you do it really slow, you get a different benefit than if you go really fast. Both are good, but you stimulate more proprioception when you are going faster. You probably remember that from the spinal hygiene video. If you didn't watch that, I encourage you to do that so you understand why this is important. But it stimulates that proprioceptive input into the cerebellum, which is going to improve your overall health. But specifically, this is going to help minimize future degeneration in the lumbar spine, and especially if you're having some kind of lower back issue, lower back pain, any kind of visceral or organ dysfunction that's happening from the nerves in your lower back, this is really going to help that. After you've done at least 20 circles each direction, it's also important to do a figure 8. So as you do a figure 8, when you first start this, it feels a little bit awkward, but the key is you just really want to do different directions to get the lumbar spine moving. Hopefully this video has been helpful for you. As you get in the habit of using the mobility disc regularly, you're going to have better health in your lower back and you're going to feel better.